Sandra Harris. Thank you for joining us for H1N1, What You Need to Know. Over the next half hour, we will be discussing a number of aspects of the H1N1 flu virus. We will discuss what the virus is, why it's called the swine flu, how it differs from the seasonal flu, how to prevent contraction, symptoms, and what to do if you should contract the virus. Joining me today are Susan Cooper, Tennessee's Health Commissioner, and Dr. Tim Jones, the Tennessee State Epidemiologist. Thank you both for joining us. Let's start with you, Commissioner Cooper. If you would give us an overview of where we are here in Tennessee with this H1N1 flu pandemic and the state's response.
Well, that's a great question. And what we know right now is that H1N1 flu is widespread throughout the entire state. And our response has really been remarkable. Tennessee's had a great plan. We've worked the plan, and the good news is that the plan is working. And we'd like to encourage folks, not to be scared of the word pandemic. Pandemic really doesn't talk about the severity of the disease. It really talks about the spread of the disease. And it is truly widespread, not just here in Tennessee, but across the United States and across the world.
Thank you for that definition. Pandemic is such a big word that's thrown around, and it helps to know exactly what that is.
Right, and it can be scary, and we don't want people to be fearful. We want them to be prepared.
Yes, and Tennesseans also want to know what they can do to keep from getting the illness. So if you would continue, Commissioner, and tell us what kind of tips you're sharing for prevention and preventing the spread of H1N1.
Sure. Right now, people don't have immunity to the disease, and we're anxious for the vaccine to come out over the next couple of weeks. But there's some basic tips for people to do. Things like wash your hands frequently with warm, soapy water. And if soap and water aren't available, use an alcohol-based hand gel that's got at least 60% alcohol in it. We want people to think about covering their cough and their sneeze. And we laugh, we say that's pretty simple, but somehow we've forgotten that. And not coughing into your hand, but coughing into your sleeve like that, and then immediately washing your hands if you happen to use a tissue. We need to encourage people to stay home if they have flu-like symptoms. Things like a fever over 100 degrees, those significant body aches and pains, a cough, runny nose, headache. And with this flu, sometimes there are some GI symptoms along the way. So wash your hands, cover your cough, stay home if you're sick, and most importantly, when the vaccine becomes available, get vaccinated.
Yes. A couple of questions for you related to that. When you mentioned GI symptoms, GI refers to?
Vomiting and diarrhea.
Thank you very much. It just helps to explain, get it all out there explicitly so everyone can understand.
Sure.
And regarding washing your hands, is there a certain length of time that you would like for all of us to wash our hands?
Washing hands is not just sticking your hands under the water and pulling them out. About 20 seconds. What we've been doing with children is teaching them to wash their hands in between their fingers and sing either the happy birthday song or the ABC song twice. And then that helps children really concentrate on a good length of time to get that friction going.
Great. Dr. Jones, how do the symptoms of H1N1 compare to the seasonal flu?
H1N1 influenza or flu and seasonal flu actually look very much the same, and so a patient or a clinician can't actually tell the difference and can't tell which type of flu that you have. The good news about that is that they're about equally severe. And this new H1N1 strain, while it's spreading more widely, and more people are getting it on an individual basis, they're not more severe.
Okay. Now, the H1N1 flu seems to impact different groups of people to some extent than the seasonal flu. Is that correct?
Yes. During a normal seasonal flu outbreak that we see every year, it tends to be the very, very young and the elderly that get most severely ill. So we see outbreaks in nursing homes and things like that. Most of the severe illness that we've seen this summer and this fall with H1N1 influenza is affecting young school-aged children and young adults, particularly kids under the age of 5, pregnant women, and then people up to the age of 24 or so that have underlying medical illnesses like asthma or heart disease and things like that.
Commissioner Cooper, what should people do if they think they have the flu, and more specifically, do they need to get a lab test?
Those are great questions. Just like with the seasonal flu, when you get those symptoms, the first thing you need to do is separate yourself from everyone else and go home. Get out of the public. You need to leave the workplace. And most people will get better on their own. But if there's concern, certainly we encourage everyone to call their healthcare provider, specifically if you're in one of those high-risk groups. Again, pregnant women, people with chronic disease, or young children. Again, the second part of the question
Do they need to get a lab test?
You know, absolutely not. This is so widespread that there are very few people in Tennessee who will need a lab test. Most often it is indicated for people in critical care units who are exhibiting severe symptoms of this disease. Now, people can get a rapid flu test in their healthcare provider's office, and that test is good if you come out with a positive result. But these rapid tests have a high rate of false negatives. So if you get a negative result, but you have flu-like symptoms, it doesn't mean you don't have the flu.
Okay, so great. Tests are not necessary.
Correct. You know, early on we tested as we were learning more about the disease, but now, you know, most people, the testing and the treatment need to be separated. If you go get one of those confirmatory tests that's sent off to a laboratory, the treatment decisions need to be made at the time the person presents to their provider offices, not 4 or 5 days later when the lab tests come back.
Now, I noticed, Dr. Jones, you were not in agreement, but I want to talk more about the vaccine. Do people need to get 2 vaccinations this year?
Yes.
Yes.
It's very important that everyone gets their seasonal influenza vaccine just like they have in past years, and that actually has 3 different types of flu that are covered with that. But this year there's a separate vaccine for the H1N1 flu. Basically, there wasn't time in the season to get the new strain into the regular seasonal flu vaccine. So 2 vaccines. We encourage folks to get out and get whichever one is available. You can get both at the same time if they're both available at your provider's office. And they come both in the injection form and also now as a nasal spray.
Oh, that's nice. The injection and the nasal spray, and they're available for all ages? Because I know some children are kind of needle phobic.
Yes, under the age of 6 months, there is not vaccine available, and therefore it's really important that adults and other people that are around young infants get themselves vaccinated so that they can protect the very young ones. Yes, and there are several brands of flu vaccine out this year, and each one has a slightly different age category that they can be used in, but providers should have lots of different ones available for people.
And if you would please clarify if there are those who should not get this vaccine.
Really, obviously we encourage people to talk to their physicians if they have severe underlying disease, but really the main thing is just people that have egg allergies. And all of the vaccine that's produced in the United States now initially is the virus is produced in eggs, so people that have that allergy can't take it, but virtually everyone else can.
Okay. Now, what about the safety of the vaccine? Commissioner Cooper, some people may have concerns since it's been developed so quickly.
You know, we hear that all the time, and this vaccine is developed just like the seasonal flu vaccine is every single year, and so there's not a new process for how this has been made. There's some fear out in the world right now because people look back to 1976 when there was an episode of flu with the same name, a swine flu. But vaccines are made very differently now than they were then, and certainly have the highest purification standards, and certainly these vaccines are safe, or the government would not be having people, you know, suggesting that they take them.
Now, I know that you mentioned there are different types of vaccine, Dr. Jones. The question is, when will it be available here in Tennessee?
The seasonal flu vaccine has been available since early September, which is actually earlier than it has been in past years, and it does not wear off during a flu season, so there's sometimes confusion about that, but the sooner you can get it, the better. The H1N1 vaccine is coming out in the first week of October. It'll be coming out in small amounts first, so hospital workers and pregnant women will be getting it initially, but very quickly the amounts will be increasing, and by late October and through the flu season there will be lots available, and essentially there will be enough during this season for everybody in the U.S. who wants it to get it.
Okay. Now, where will they be able to go? Just to hospitals, just to their doctors? Where can they go to get the vaccine?
We are making this vaccine available in as many places as we can. So it will be in pharmacies around the state. Public health departments will be having large campaigns that will be completely free there. Any physician who registered and put in orders will be able to receive it. So there should be a vaccine pretty much every time you turn around. It should be widely available.
And that's good to know that there will be some places that will offer it free to those who need that assistance. That's good to know. There are rumors that this vaccination will be mandatory. So is there any truth to this, Commissioner?
No.
No.
Absolutely not.
Good.
Again, just like the seasonal flu vaccine is highly recommended, there are no mandates in place, and we do not anticipate those to be in place.
Now, for Dr. Jones, what about the antivirals such as Tamiflu? Can something like Tamiflu be used against H1N1, if at all?
Tamiflu is one of the antivirals, sort of like antibiotics for the flu. It works quite well. It has to be started within the first 1 or 2 days of illness, and the huge majority of people that get the flu don't need it. And as Commissioner Cooper said, the large majority of people that get the flu can stay home, liquids, Tylenol, and will get better on their own. Tamiflu, we encourage folks to see their medical provider if they have underlying medical conditions that might make them more susceptible, certainly for people that are hospitalized, but most people won't need it.
Okay. Now, to transition to more focus on our young people, we hear a lot about school closings and staff members becoming ill. So, Dr. Jones, what are the current recommendations for our schools?
The decision to close schools in Tennessee is entirely a decision of the local school district and the school superintendent. However, we consult with them often and are there to answer questions. Basically, for medical reasons, there's no reason to close a school. As long as sick people are kept home and only well people are in school, that's really the safest place for kids to be. So really, I think the only reason we will be seeing schools close is if there are just so many people sick that there aren't enough teachers or aren't enough students to keep going.
Okay. And Commissioner, are there similar recommendations for how other groups, how businesses should proceed?
Certainly, same recommendation, no reason for medical reasons to close a business, but if the work of the business cannot continue, we certainly would recommend that they consider those things now. We've encouraged all businesses, all facilities across the state to have a plan, and what are those essential jobs that need to be done? Can you do cross-training of personnel to fill in if people are sick? Do you have policies in place that allow people to go home and stay home until they get better? And to think about ways of doing work differently, telecommuting, using the computer or the Blackberries, instead of having face-to-face meetings, thinking about having conference calls instead. But again, all businesses, all schools, all facilities, everyone should have a plan for what to do if you, your colleagues, or your families become ill.
Okay, and that was my next question was, what should families be doing right now and following those same procedures?
Absolutely, and specifically families with children, do you have a backup plan if a child becomes ill at school so you can get that child home? Do you have a backup plan for child care if you as a parent become ill? Because certainly you want to try to separate yourself from your children because you don't want to transmit the disease either. Making sure you have 3 or 4 days supply of fluids and baby food and diapers at home so that you don't have to get up out of bed and run to the store to pick up necessities.
Now, Dr. Jones, how is Tennessee, how is the state monitoring the H1N1 flu activity?
We have a number of systems set up. We sort of call them surveillance systems to be able to keep close track of how flu is affecting our communities. We have special sentinel physicians or special clinics that are identified around the state where we keep track of what percentage of the patients that they're seeing have the flu. We monitor laboratory testing around the state. We get daily reports from hospitals about what they're seeing in their emergency rooms and in their clinics and hospitals. And then we follow school absenteeism data. So, it's impossible to give a number, exactly how many Tennesseans have the flu, but it certainly allows us to assess patterns and determine, which communities are being particularly affected at any given time.
Okay. Is there some information about H1N1 flu that cannot be released?
We never would release personal patient information. We don't do that for any disease, just out of respect for people's privacy. But at any time, if any information that the public needs to know to protect them, we would never ever hide anything like that. And again, with the flu, we don't publicize it during a normal year. Every time a person is in the hospital or is staying home with the flu. But we certainly do want people to feel educated so that they can be, comfortable with what's going on in their community.
Okay. Another question for both of you, and please feel free to weigh in. We were originally introduced to the H1N1 flu as the swine flu. Where does that come from?
This particular strain of the flu was initially identified in swine or pigs, and soon thereafter was detected in a couple of kids in California. But after that, it's being spread entirely through humans, and we are not, humans are not getting it from pigs anymore. And in fact, I think something that people don't realize is that all flu starts out in the animal kingdom. Birds, swine, that's not unusual. It's just that occasionally one of those strains will jump into the human population and can spread, but that does not necessarily mean, that it's worse or more dangerous than what we see every year.
Okay. Now, Commissioner, people are going to have some more questions, I know. Where can they go to get additional information?
Certainly, we encourage folks to talk to their healthcare providers if they're interested in information specific to their case. The Tennessee Department of Health has a website, www.tn.gov/health, and we have a box that has the most up-to-date information on the H1N1 flu in our state. It's updated on a daily basis. And then for those that don't have access to a computer, we've set up a toll-free hotline that's good across the state, 1-877-252-3432. And that number can also be found on our website. So we are encouraging people, if they do have questions that have not been answered, to use that number as well.
Okay. Just a couple of more questions for you. I know that our viewers will want to know your background. What makes you the expert in talking about H1N1 and how we can protect ourselves? So if you would please just let us know a little bit more about your background. Let's start with Commissioner Cooper.
It's funny how you become an expert on these things, but certainly my clinical background is I'm a nurse, have been a critical care nurse for a number of years, and also an educator in that world, and have worked with special populations for about 30 years. But I think my greatest expertise is being a mother of 3 and a grandmother of 4, and someone who happened to have had flu-like symptoms on more than one occasion. A lot of this is really practical advice, and so where Dr. Jones is certainly the experts with viruses and medications, You know, we really want to make sure that our department does what our mission is, which is to protect, promote, and improve the health of all Tennesseans. So, again, those practical ideas, wash your hands, cover your cough, stay home with your sick, are good for this flu, the seasonal flu, and other instances when you happen to be contagious.
Okay. And Dr. Jones, as the epidemiologist, what is your background?
I'm a physician and have practiced medicine. I came to Tennessee as an employee of CDC, and now as the state epidemiologist, my job is to sort of track diseases on a population basis and help give people recommendations. And probably most importantly, I'm a father, and so I think it's important to know that the same advice that I would give to a community or anyone else in the public are the same things that I would do for myself and my family.
Mm-hmm. And you mentioned CDC. CDC, what does that stand for?
I'm sorry, the Center for Disease Control in Atlanta. And that's a national organization that also does a lot of research and work on tracking diseases and also how to prevent and treat them. The state health department also has units that do the same thing, and that's how we sort of keep such close track of diseases like this.
Okay. And just to give us all an overview of why we're here, which is, of course, to discuss the H1N1 flu pandemic here in Tennessee, if you would please, we'll start with Commissioner Cooper. Just let us know once again, what can we do to prevent? And also, how long should we stay away from the population when we come down with our symptoms?
Good questions. Again, until the vaccine is widely available, wash your hands frequently, soap and water, or use an alcohol-based hand gel. Cover your cough. Stay home if you're sick with flu-like symptoms, fever over 100 degrees, body aches, respiratory symptoms, cough, sore throat, headache. And stay home for at least 24 hours past your last fever. Now that's past your last fever without taking a medicine to relieve you of the fever, like Tylenol, ibuprofen, Motrin, those things. So at least 24 hours. Or if you're continuing to cough frequently, this virus is transmitted through those droplets. And so, again, recently I've had some flu-like symptoms. I stayed home, I went to bed, drank lots of fluids, and canceled a trip to Washington because I didn't know who I'd be sitting next to. And if indeed I had the flu, I did not want to put them at risk. And then most importantly, just like with seasonal flu, when this vaccine is widely available, we encourage all Tennesseans to take the vaccine because the vaccine can prevent the flu.
Excellent. Dr. Jones, any further notes for our viewers? What can we do to stay as healthy as possible this flu season?
Well, I think one we don't want people to panic, but we want them to be educated. And I think it's very important that people do that, including listening to things like your show. It's also important for people to remember that, this pandemics go up and down and wax and wane. And we are seeing a lot of flu activity in early October and as school gets in session. And the disease may go down for a few weeks, but we expect to see outbreaks like this last for many weeks and in fact usually up to 2 years. So we want people to continue to remember these messages in the coming weeks and months.
Well, thank you very much. Thank you to both of our panelists, Commissioner Cooper, Dr. Jones. Valuable information, very timely. And that's all the time we have today. So if you would like more information about how you can protect yourself against the H1N1 flu virus, you can visit www.wnpt.net/H1N1. For Nashville Public Television, I'm Sandra Harris. Thank you for joining us.